some sturf today.
Yes. I don't know if you're in a nurse's field, you just thought to yourself, like, how did this person become a nurse?
How did we get here? How did you get here?
How did you get here?
How did you make it this far? Like, this can't be it for you. This can't be life for you. Like, the kind of mistakes that you're making, how did you get this far?
I know they unalived a couple patients. Like, I know for sure.
They did what?
Unalived a couple patients.
Oh my God.
They had to, because how else?
Unalived. She said unalived a couple patients. That is the equivalent to killed. You know they killed a few people. Is that what
they had to at some point in my life? Because there was this one time I first started nursing. I'm not dumb. Like I know. Like,
you know some things
I
about
know
some
things when I first started. She tried to give an entire syringe full of insulin. Like, it was like almost 40 units in there.
40 units?
Yes.
Wait.
Of insulin.
Like regular insulin?
Regular, and not no Lantus or none of that. It was like some short acting insulin, and I was like, no. I was like, no, go read that order again. You about to kill your patient. She almost killed that patient. I was like,
no. Wait, so what was the real order? Like, it wasn't no 40 units.
It was like 4 units.
4 units?
Yes, because human log be like 4 units. It don't be like no big ass
40 units. No.
Girl, she was dumb as hell. Dumb. I was like, oh, okay.
Short acting insulin, 40 units.
Because I know Lantus, you could give licensed units. Yeah.
But
no, it wasn't. It was short acting.
And it was 4 units.
It was 4 units.
And she was about to give 40.
And she asked me, because I wasn't the one training her, but I've been there for a little bit of time, but I still was kind of watching her because she would ask me questions. Like, I'm really approachable, so she was like, can you just check to make sure this is right? And I'm like, okay, what medication is this? So she told me, and I'm like, no, girl, no.
I'm glad we did this.
I'm glad she asked, because imagine if she gave it. She would have killed the patient.
Yo, you are absolutely right.
It's a lot of those.
It's a lot. It's a lot. Well, I'm trying to think. Oh, I remember talking about this on TikTok. I remembered I was supposed to be training someone. And as I was training them, the more I asked them questions, the more I realized, like, bro, like, this can't be something. And, you know, in some cases you think, okay, it's not that you're a bad nurse. That's not necessarily the case.
No,
sometimes,
they're really sweet.
Sometimes it's just... Why you laugh?
Because they do be sweet. They be real sweet. But it's like...
You can't be sweet and be a successful nurse. You need to know what you're doing.
You could be sweet and dumb.
Yeah, you could be sweet and dumb. Like, sweetness doesn't get you through it. But she was asking, like, what it meant to push a drug.
Young nigga move that dope. Young nigga move that dope.
And I was like, are you familiar with IV drugs? And she's like, sure I am. Okay, so when I say push the drug, like administer via IV, that's what I'm talking about. And she was like, oh, no, I knew that. I just wasn't super familiar with, you know. And then she starts going on a tangent, and I'm like, it gets to a point where you realize, okay, the over-explanation is compensating for something. And it was just one thing after the other that she would do that would make me look at her like, bro.
Pushing potassium.
Stop! Oh, for the record.
Never.
You never push potassium.
Like, you're gonna make them have a heart attack.
It's just their cardiac arrest immediately, heart stop. That's it. Pushing potassium. Nobody ever did that before.
No, but I'm just saying. If that's something that really came out of her mouth.
Yes, but that's why it's so important for you to not be an incompetent nurse. Yo, why is this so funny?
Because this is a everyday. Like, I know everybody that has nursed at some point in their life has a story of it's like where you have to double take. Just somebody just
look at them like, bro, you're a nurse? Like, we're the same profession?
Yeah, but remember when I want to say name.
You better not say name.
When so-and-so asked what normal saline was.
Bro.
This is when we used to work together too, by the way.
So we used to work together. And there was this one nurse that we worked with.
She was my supervisor.
Our supervisor. Y'all need to understand something. Like, it is so important for a supervisor to have had floor experience as a nurse. Having seen patients, patient care. And some of these establishments be way too quick to, like, promote these nurses. Like, oh, you've been here for 10 seconds? Thank you so much. You're just going to go ahead and be the supervisor.
Yes.
Bruh. Homegirl, okay, normal saline can be a bag, like a liter of fluid where they, you know, put it attach it to the IV and they administer it over a long period of time, or it can be a syringe, normal saline, which is what we use to just
IVs to flush it.
Just flush it. Just cleanse the IV before you start giving something else. That is like standard. Standard nursing-ish.
Normal saline is like an all-purpose liquid. We don't.
All-purpose, compatible with everything.
Everything. Yes.
She said, "What is normal saline? What is that?
What is it for?
What is a flush?
What does it do?"
What do you mean?"
Ask my supervisor.
As our supervisor.
Imagine we got in trouble for using normal saline, and she's like, "What did you use this for?"
Bitch, you mean? Everything. How did you get here? That's not good.
Like, why are you my supervisor?
Why are you here?
I'm very blunt. I would have said that. Well, why are you my supervisor?
There was a point in time also where we were doing like the COVID like drive-throughs and stuff, and they were saying that you remember they were saying that that certain people didn't need to wear masks.
I kind of do.
They were saying like,
oh no, that's when the intake people and
sticking their heads. This is when COVID just broke off. Nobody knew what was going on.
This was fresh, like the end of March 2020.
Bruh. And we just opened up
outside. Yes.
Just opened up doing the drive-thrus where people were just coming to get swabbed. And there were people like at a certain station where they were literally like sticking their heads into people's cars to hear what they're saying because of the masks and everything that was going on.
The intake people that do all the registration, they had to grab cards from them. These people.
And they were saying they didn't need as much personal protective equipment as everybody else. And I'm like,
mask. I said that shit don't make no sense.
Makes no sense.
I said it just like that too. That don't make no fucking sense.
No
so you
sense.
gonna have their heads in the car and they can't wear no mask, so you just want them to die, then you're not gonna have no intake people.
No, you're not gonna have no intake people.
She just looked at me. I said, I'm dead
They just stared at us, but it was like 3 of us that were like, that makes no sense.
No, my
it was
ass.
a symphony. Like, it was just like a melody. Like, what? Like
me. That shit don't make no fucking sense. I'm just so loud.
And then she gets mad and then she goes and snitches on us. And then somebody comes over to us, guys, we have to remember that, it's really important during this time to work together. We have to stay alive. We don't know what's going on. Bodies are dropping.
I used to always get in trouble.
I used to give our supervisor, like the head honcho, like such a nasty attitude all the time.
He put me to the side one time.
Yo, why are you nice?
He's like, what's wrong with your attitude today? I said, well, you asked how I was doing. I told you I was doing bad because you got us outside with no water. That's when I was calling her on the walkie-talkie like, I need some water. They didn't bring me no water outside. I had an attitude.
We had an attitude for an extended amount of time because I felt like we weren't really being taken care of. And then there was also a time where we were trying to order food and we were doing it over the walkie-talkie. Somebody was like, don't do this over the walkie-talkie. I was like, I'm not going to keep running in and out to get everybody's order. Like, tell me what you want. I got the phone in my hand. Like, it's not that serious.
Yeah, no. Oh, God.
It was
COVID brought out the stupidity in nurses.
COVID brought out the stupidity. But, I mean, to be fair, yes, it's like a lot of us didn't really know what was going on.
Which is fine, because we were all, like, learning together.
We were all learning together. But there were things that, like, you don't need COVID to know. You know what I'm saying? Like, it had nothing to do with COVID. It had nothing to do with it. Like, you need to know what normal saline is.
You do.
For starters.
Starters. Theory of nursing that comes into play, but I'm pretty sure it's in the beginning.
And I also feel like it's important to understand not to confuse like being incompetent with like asking questions for knowledge. Like it's fine if you pull me aside and say to me, I've never heard of this drug before. I've never heard of this disease before. The doctor told me to go do this and I've never had to do this before.
That's cool, because I respect that.
Yes. I respect that because we're not thinking about ego and pride here. We're thinking about the patient. Mm-hmm. But then there's certain things that you shouldn't have been able to make it beyond a certain point without knowing that piece of knowledge or knowing how to do that skill.
Yes, like don't ask me what is blood. We should know. I promise these be regular questions.
Yeah, but then there's also nurses that have an issue with blood. And I was like, I feel like getting through nursing school, there is no avoiding blood. And so I want to know how you made it this far.
Yeah, I don't know. That's on them though. I think at some point they know. blood isn't for them, and they would clearly see that at the beginning while you're still in nursing school.
I remember being in nursing school, and we were at a nursing home. The first semester is always a nursing home. And there was this one student that was in there with me, and we had to, obviously, there were like 4 of us in there trying to turn this heavy patient to clean her. And this one girl was standing there not doing anything. She was just standing there. And I looked at her, I was like, yo, can you just maybe stick a hand out? Like maybe just push a little bit more? Like, come on, help me. And she's like, oh, this is not what I'm going into. I'm gonna go into plastic surgery.
Okay, if your patient knocked out and shitted on himself while they was still knocked out, you would have to change whatever.
Like, it was so baffling to me. And I wanted to be like, yo, you're not gonna make it far. Like, there's certain things that you gotta do to get to where you want to get to.
The foundation.
This is the basic. The foundation. Jesus. I don't know. It makes me nervous sometimes. Like, sometimes I want to be like, let me help you. And then other times I'm like, I really don't want to be anywhere near you. Because if some
like,
shit pop off,
I
don't need my name attached to Jack
Page.
Oh, you know what that reminds me of? So, back on the East Coast, I was working with this one nurse who... So, with diabetic patients, you have to check their sugar before they eat. And you have to treat them before they eat. Sometimes there's a little bit of give depending on what the actual blood sugar is. There's a little bit of rule breaking, but it should never be like I check your sugar at 7 and at 10:30 I'm just now treating it. So sometimes the morning just gets busy, and at that point I have to check it again. I'm gonna just check it again. And this one nurse had came up to me. She had checked the blood sugar maybe at like 8 p.m. It was night shift, and it was maybe close to midnight. And she's like, I just wanted you to co-sign this insulin administration with me. And I was like, wait. I was like, at first I was like, yeah, sure. What was the blood sugar? And she pulls it up. And it was like 270 something. And I was just looking at it. And I looked at the time. And it said 20 military time. It said 8 something p.m. And then I looked at the time on my watch. And I was like, oh, that's the wrong time. And she's like, no, that's when I checked their sugar. Girl. So this is for 4.5 hours ago?
Your patient blood sugar say HI on the machine now.
I was like, can we recheck it? Because I don't want to co-sign on you treating a blood sugar from 4.5 hours ago, damn near 5 hours ago. I don't want to do that. We recheck it. It was already 100 and something points higher, and he was there for like non-compliance for his diabetes. I was like, why would you do that? We don't need to be in the stupidity together.
Not together.
I don't need to co-sign stupidity. Come on. Oh my gosh. But it's cool, you know. She not cool, but she learned. She learned.
Maybe that was her first time really dealing with diabetes. Like, I don't know.
She was old.
Never mind. I can't.
She'd been in the game for a long time,
and now she forgot.
And she needs to retire.
Yeah.
Can't forget that kind of stuff. It's time to say, like, all right, sayonara to nursing.
Yes.
That can't be it.
Yes.
But you guys should definitely talk to us. Let us know what else you want to talk about. Nurses, CNAs, nursing students, respiratory therapists, your experience with nurses, doctors. Just, drop some stuff in the comments. Tell us what you want us to address next. You got something to tell the people?
No, I think I said it all.
That's it. Thank you.